So with this background, I would be focusing on our first experiment, and this experiment basically is a handheld device experiment for rural poor, and is being conducted with in partnership with care hospitals. And yeah, it's the location of the project is in Yavatmal district in Maharashtra, and the type of population here is basically rural and tribal. So for this project, I'll probably spend some time on this to try to explain what are the important features of this project and
sorry to interrupt. The presentation seems to be moving on its own, so I'm going to try to stop it and bring it back. It's not something I'm doing deliberately. Apologize.
They're one of the cores of the project, and as we move into the village, so we are working around in 30 villages around Yavatmal town, and that's a pilot site. And as soon as we move into a village, we first try to identify a village health champion, and we have criteria to identify who could be a village health champion. We try to engage with community to help to tell for them to come forward and engage and come forward with a name and say that she could be a good village health champion. Now, the purpose for her to be is basically what we look at, that she, of course, we're not looking at somebody who would be educated, because we wouldn't find somebody, but we are looking at somebody who could actually have some inclination towards health. So we have some cases of village health champions who have led a whole lot of changes in the village and banned alcohol shops or done something good with respect to health, or they seem to be more engaging with the community. So those are the women we pick up, and we start to train them. And once we start training them, we actually call them to Yavatmal town for the next 3 months. So there is a course defined for them, which they go through at various stages, and they are trained for various levels of engagement. Of course, we train them basically to become village health champions and make them understand about health, how to realize emergencies, or how to realize some basic symptoms, just to equip them with and make them familiar with health aspects. And so they're basically selected from the village, and we try to keep the village health champion from the village itself, because a village is a very small community of having maybe 1,000 lives or maybe 1,000, 2,500 lives. That's how it would be. So all of them know each other very well, and they all trust each other a lot. There is a lot of strong community bonding between them. So a village health champion coming from the village is expected, and she does very well be able to bond with their fellow households in the village, and that's one of the reasons we make sure that she's from there. Of course, transport and other things also come into play. We train her in basic healthcare, and we equip her with basic diagnostics and over-the-counter drugs. And the basic diagnostics are all of it are for blood pressure, for temperature, and all of them are digitalized, so that she doesn't have to actually read the temperature or measure the blood pressure, and that's what. So that's the first aspect of the project of developing village health champions. The second thing the second aspect of the project is a handheld device. Now, what is a handheld device, and why are we looking at? Basically, this is an integration of a whole lot of different levels of hardware and software, and it is embedded with a diagnostic tree, and the handheld device actually does all the work for us, and the village health champion is a carrier of that handheld device, and she just operates it. And when we go forward, I'll tell you what are the ranges of work that the handheld device does. And the device has been actually equipped with a biometric identification, a smart card reader, a connectivity is there to sync in and sync down the data, a big screen for displays, as for SMS receiving and sending, and of course the diagnostic tree. Now, what does the diagnostic tree do? So the village health champion actually treats a patient through the handheld device, because there are a whole lot of primary ailments wherein a doctor is not needed. So as I was discussing with Dr. Ranganathan also yesterday about Vatsalya Hospital, about how do they cope with the loss of your lack of doctors not available in rural areas or in tier 2 or tier 3 cities. So he beautifully put it by saying that we have de-skilled the work. So where a doctor is not required, we don't make him to be there. A digitalized thermometer can actually, anybody of us can actually know the temperature. We don't need a doctor to do that. So there are a whole lot of ailments which actually can be looked into without a doctor's referral or without a doctor's advice, and that's when we embed the handheld device with a diagnostic tree which actually flows exactly and asks questions exactly the way a doctor would ask. So whenever a patient visits the village health champion, she asks certain questions and just follows what comes on the screen with respect to questions, answers. It might end up with some kind of a diagnostic answer, might end up with some kind of drugs that need to be given, might end up with saying that, okay, refer the patient to the doctor or something like that, or call the doctor. So that's how it goes. And of course, it connects the back end and the front end of our work. The other aspect of this project is the preventive and promotive products. So we have a whole range of preventive and promotive products that actually cater to preventing airborne, waterborne, and vector-borne diseases, and we buy them on wholesale and then subsidize the cost to the people who are in the villages. Sorry. And the fourth aspect is the OP health insurance card. So we have the preventive aspect, the primary care aspect, and based on the two, we have launched OP health insurance product for the pilot site. Well, it is probably one of the only standalone OP health insurance. That's it. There is no IP involved into it, and we had our own reasons for looking into it, which is now, and this is basically a smart card based product, wherein so point of sale and point of service is the same. So the VHC actually issues the health insurance card through the handheld device, and then also services the patient at the same point. So that kind of cuts off the transport cost and the cost of consultation. So that's a big area of chunk that we have tried to take care of to amalgamate the point of sale and point of service at the same place. Yeah. Well, yeah, this is just a flow of how things happen, and I will probably I've already discussed how it, but I'll just run through how that is. So we have village people who actually come to the VHC, who's actually equipped with a handheld device, and they are then they pay the money for the insurance. They buy the card. Card is handed over to the insured. The insured may come back for a particular problem and say that I'm having cough or I'm having fever and what needs to be done, and that's when she begins to flow the questions through the diagnostic tree in the handheld device, which is actually connected to a server at the town. Now, if whatever information that is being entered into the handheld device is actually then transferred to the server, which is connected to the clinic at Yavatmal. So suppose, for example, if the diagnostic tree ends up and says that refer to the doctor or speak to the doctor, this is not looking a very basic primary illness, it's something more. That's when a message is sent to the clinic at Yavatmal town, and then doctor looks at all of, because in front of his screen he has the access to the server. In his screen he gets to see all of that, what has been the conversation between the patient and between the VHC with respect to the flow of questions, answers, and based on that he either sends an SMS to the VHC on the handheld device asking her what to do, or he may even call her and then speak to the patient directly, or may even ask her that send the patient for reference. So it could be just then that's the doctor role, and that's when he takes a decision. Yeah. Yes.
Is the biometric captured at that point of time?
Yes, it is captured at that point.
Okay. And how is the communication? How is the communications between the handheld device and the doctor's happens? Because I'll tell you the practical problems. What happens is when you give a device and it has some buttons in it, it is difficult for doctors to input those informations. So is it a text message which goes, or is it there is some oral communications through mobile or something? How is that?
Okay, so as I said, that whatever is being entered into the handheld device, the questions that flow, they are there in the server against that particular insured's treatment. The doctor, suppose it comes as a reference to the handheld device, an SMS goes to the doctor who has the system in front, and SMS comes on his system saying that X BHC wants X insured patient's reference or something like that. That's when he opens his file and he gets to see all of the conversations that have happened. Based on that, if it's the doctor's call at that time, if he wants to speak to the patient and wants some more clarification, he actually can call the VHC on her mobile and talk to the patient. That is one way. Second thing, if the doctor after going through questions and realizes that it needs immediate reference to me, he can just send an SMS on the system itself, send the patient or refer the patient. That comes to her handheld device as an